First on Fox tonight, it's been more than 2 weeks since Oregon saw its first death from COVID-19. Since then, 17 others have died. Hundreds have tested positive for the virus. But now, as we approach April, we wanted to ask what our hospitals seeing right now on the front lines. For that, we bring in Fox 12's KANDRA Kent with the very latest. KANDRA?
Wayne, we wanted to specifically look at patient care, and the good news is that right now our hospital systems statewide are not overwhelmed with COVID-19 patients. I did speak with one hospital that says the vast majority of its patients require very little intensive care and are often in the hospital for just a short stay. But these hospitals do understand that all of this could change in a matter of just days. It's the calm before the storm. Hospital workers on the front lines of Oregon's COVID-19 fight are bracing for an influx of sick patients. When it will happen is the million-dollar question.
We have not seen the kind of surge that we were anticipating.
Legacy Health says so far there's still plenty of intensive care beds and ventilators available at hospitals. It's a glimmer of good news and reflective of conditions statewide. Right now, only 5% of the ventilators in Oregon are being used. Compare that to warnings just weeks ago when state officials predicted hospitals could be overwhelmed by early or mid-April. Those dates are fast approaching.
Oregon does seem to be on the lower growth path. That's where we want to be, and I think that's where we can be if we stay with these interventions and follow them through.
Dr. Peter Graven is a data scientist at OHSU. He's forecasting models on COVID-19's anticipated path through Oregon. Graven told us those early, dire predictions about hospitals becoming overwhelmed in April were expected if the state did nothing to slow the spread. But we're more than 2 weeks into school closures statewide and nearly a week into Governor Kate Brown's most extensive restrictions yet, an order mandating that people stay home when at all possible. Graven says it will be a couple more weeks before scientists will be able to measure whether those directives are working, and they'll be paying close attention to hospitalizations and the death toll.
And if ours just go up gradually, or even better, begin to slow down and stop going up, that's when we know that the interventions we're doing are beginning to work.
Graven's takeaway: it's way too soon to know if Oregon's social distancing is working.
We want to be cautious about it because we can't let our foot off the pedal here.
And hospitals know chaos can erupt suddenly.
What we've seen in other countries and other locations is that spike comes really quickly.
But any delay just means a better chance to prepare.
We will continue to hope for the best, but plan for the worst.
So, of course, the big question is, when might hospitals see that peak capacity? Well, nobody can give specific dates, but one study by the Institute for Disease Modeling now points to late April or early May. Reporting live tonight, KANDRA Kent, Fox 12 Oregon.